1470 WOCA. Ocala.
All right, 10 minutes before 11 o'clock. Thank you for tuning in. Everybody has this dream that one day we're going to wake up and there's going to be a headline on the internet, I guess. Newspapers aren't out there a whole lot anymore. But there will be news that cancer has been defeated, cured, or there will be no more cancer ever. But that's not the way it is yet, so we still have to deal with it. Dr. Michael J. Birrer is on the phone. He's the Director of Medical Gynecologic Oncology at Massachusetts General Hospital and the Professor of Medicine at the Harvard School of Medicine. He's talking to us about 3 facts that every woman should know about ovarian cancer and the BRCA gene. Dr. Birrer, good morning, sir.
Good morning. Thank you for having me.
Thank you. Where are you calling from?
I'm calling from Boston, Mass General.
How's the weather up there today?
Well, we're a little cloudy, but we got through the hurricane, so we're okay.
There you go. Oh, yes. It was the same hurricane we went through. Yeah. Yeah, we sent it to you.
Thank you.
So this is a really serious topic. Is there ever going to be a day when we say, you know what, there is no more cancer? Now we have something else to worry about?
Well, we certainly hope so. I think that, as you probably know, cancer in general is a pretty complex disease. It is a disease of aging in many ways, and so there are a lot of challenges with it. But I've said this for the last couple of years in particular. This is, in my 30 years of being a medical oncologist, this is the most exciting time I've ever seen. Things are changing very rapidly with lots and lots of new therapeutic options for our patients.
Is the old rule still the true rule that the earlier you detect, the better it is, the more likely it is that you'll survive?
Generally speaking, yes. I think early detection and even prevention are the optimal ways to approach cancer, and developing those tests and those preventative therapies are actually quite challenging.
Do the therapies that would prevent one cancer apply to other cancers like ovarian cancer?
I think the answer is yes and no. I think that there are some preventative or some early detection assays which may extend over a number of different tumors, but there's a lot of things about cancers that are pretty tumor specific, and ovarian cancer is a good example of that.
And does all people that have ovarian cancer have the kind with the BRCA gene?
Yeah, so let's talk about that. So historically, we've known that 8% of ovarian cancer patients have a fairly strong family history, usually a mom or an aunt with either breast or ovarian cancer. Those patients historically have been found to have a mutation in the BRCA1 or 2 gene. Now, our understanding of it has changed radically because we know that grossly underestimates the number of patients who actually have these mutations. It's at least double that, up around 15 or 16% of patients have a mutation in BRCA1 or 2. And it's important to note that those additional patients come into the clinic with ovarian cancer, no family history. So it's really changed our view of this disease, and right now, I consider it standard of care that we recommend every single woman with ovarian cancer get sequenced for BRCA1 and BRCA2. Every single one.
What does that mean, sequenced?
Mm-hmm.
So we take, and I do think there's some misconceptions on this. What that means is it's not complicated anymore. It's a tube of blood. Any lab, any clinic can draw the blood. It gets shipped off usually to a laboratory, but hospitals like Mass General have their own sequencing capability, and the patient's DNA is isolated, and it is the BRCA 1 and 2 genes are actually sequenced, meaning every single nucleic acid base pair is identified. And to do that, we can tell whether the gene is normal or whether it's been changed. And in those patients where it's been changed, it has very, very important clinical implications because, remember, we're taking it from the blood. That means if we find a mutation, it's in every cell of that patient's body. And therefore, it can be passed on to their daughters and sons, and they'll be at risk for cancer. And in fact, they could pass it on to the next generation. So it's really important that we identify these cases so that we can give genetic counseling, and if need be, put those sons and daughters on the appropriate screening tests so that we catch those diseases early.
Okay, so help me understand this. If a male has the BRCA gene, obviously he wouldn't get ovarian cancer, but could he be a carrier for his own daughter?
Correct. So two things. They would certainly not get ovarian cancer, but he actually would be at risk in certain cases for prostate cancer or pancreatic cancer. So there would be some disease risk to himself, but as you point out, quite correctly, he could pass that on to the next generation, and it could be in his daughter.
Oh my gosh!
This is how it happens.
So so what do we do? I mean, so do we all need to get a blood test to make sure we don't have it? And if we do, what do we do? Just not have children? How do we?
That'd be awful.
Yeah. How do we deal with that?
Yeah. So it's knowledge comes with good news and bad news, and part of what you just outlined, I think, is some of the challenges. We're not at the point where we're recommending the general population get sequenced for this, although there have been a couple of scientists who have begun to talk about it. It's not recommended because A, the cost, B, it would probably raise a huge amount of anxiety to do the general population. Right. But what we are recommending is for all ovarian cancer patients, they should get sequenced. If the mutation is found, all hope is not lost. There's lots of things we can do. So, for instance, we would then immediately recommend that children at the appropriate age get sequenced to look for the same mutation. And then, for instance, daughters, a very regimented schedule of mammograms and pelvic exams and other screening tests would be done to make sure that if the cancer develops, that we catch it early. And then usually after childbearing, so let's say they're 35 or 40, they've had their children, we would recommend what's called a prophylactic bilateral salping ovarectomy, meaning we remove the tubes in the ovaries, which is about 98% protective for the development.
Even before there's cancer, you mean?
Correct.
Oh, wow. Okay.
So can a woman have a normal pregnancy and a healthy baby while having this gene?
Absolutely. And you have to think about the big picture here. Go back maybe 25, 30, or even 40 years ago, we were oblivious to all of this. So all these genes were being passed on, and unfortunately these patients were at risk, and we wouldn't counsel them, we wouldn't screen them, and we wouldn't remove the ovaries. And so we've come a long way where we at least can limit the impact of these genetic abnormalities.
So if a woman is told she has the mutated gene and then has a decision, do I have my ovaries removed or not? If she says, you know what, I want to have children first, what is the risk there?
Yeah. So this is all a part of the genetic counseling, and there is a whole group of genetic counselors who dedicate their life to this and have open and honest conversations about this with their patients. So generally speaking, the risk of developing ovary cancer and breast cancer in the setting of this mutation is very low in the teens and the 20s, and so we don't even recommend sequencing those patients until they're 21 or older. And generally speaking, the risk goes up with time. The risk of breast cancer can be certainly ameliorated with mammograms, which are very sensitive and accurate, so that would be a recommendation. And then usually most patients are counseled that if they want to have children, that they should think about having the children before the age of 35. Okay. And then after that, again, the prophylactic procedure is done. I would emphasize something which is also a misconception, that oral contraceptives are 50% effective at inhibiting the development of ovarian cancer.
Oh my goodness! We need to give the listeners information so they can look it up because we're out of time. Can you give us a website? Yeah,
the one we use most often is called myocjourney.com. OC standing for ovarian cancer, myocjourney.com. Terrific website, in layman's terms, understandable, very accurate information.
myocjourney.com. Dr. Michael Birrer, thank you so much for what you're doing. You're making the world a much better place. Thank you for that.
It's a pleasure. Thank you for inviting me.
All right, we will take a break. This is WOCA Ocala.
We've been losing for us for a long time.
She's spending time in North Carolina today. He's in Ohio the day after their appearances at an NBC National Security Forum where Trump suggested
there would be a shakeup if he's elected.
Well, there'd probably be different generals, to be honest with you.
Clinton held firm in her stance that we should not send ground troops to Iraq or Syria.
Fox Radio's Rachel Sutherland. And Ford expanding a recall for doors that can pop open while vehicles are in motion, now adding 1.5 million cars, SUVs, and vans. Fox News, we report, you decide.
Psst, hey, it's me, your car. No, it's not the voice of your car phone or your GPS that gives you driving directions. I'm sorry to interrupt your tunes, but we need to talk. Take a look around. I'm not the new car I used to be. The season's dirt and mud really did a number on my carpet here. And that iced coffee you spilled, that didn't help. And with the rain showers and all, I know it's going to be a real mud bath in here. So do me a favor and get a set of WeatherTech floor liners. Got it? Now, how about a wash and detail? What do you say?
WeatherTech floor liners and cargo liners keep your vehicle's carpet safe from spills and messes. Made of the highest quality materials and laser measured, WeatherTech floor liners are specifically designed for your vehicle. And they're made in America. If it could talk, your vehicle would thank you. Order yours today at WeatherTech.com or call 1-800-CarMats. WeatherTech. Complete protection, completely American-made.
Council.
It's time for Farm and Ranch headlines on the Southeast Agnet. I'm Darren Spearman reporting. USDA's Farm Service Agency announced the PLC payment, that's called the price loss coverage, for peanuts this past year, ending in July. The national loan rate, of course, is $355. The reference price is $535. The average price on all peanuts last year was $386. So farmers would qualify for a payment between the $535 and $386. However, that has been downsized some because of a budget reconciliation or sequestration, they call it, by 0.932. And it'll only apply to 85% of the farm base on peanuts. So it's going to end up with about $138.87 per ton is the PLC payment this past year, and it will be downsized to $126 because it only applies to 85% of the farm base.
Hey, produce farmers, listen up. You know me. It's Nathan the Nematode, and I'm your biggest problem. That's because me and millions of my little friends are below ground right now, getting ready to feast on the roots of your crops. And we know you're having a hard time stopping us. So while you're searching for solutions, we're gorging on the season's harvest and
At approximately 4:25 p.m. today, Nathan the Nematode and millions of fellow nematodes were pronounced dead thanks to Magistine, a powerful yet worker-friendly bionematicide. Apply Magistine pre-plant or every 3 to 4 weeks right up to harvest to improve your crop. Magistine controls yield-robbing nematodes and soil pests to deliver stronger, healthier roots and robust yields. The effective, worker-friendly, and sustainable Magistine just might be a lifeline for your crops. Goodbye, nematodes. Hello, Magistine. Get yours today. Visit goodbyenematodes.com or call your local supplier. That's goodbyenematodes.com.
I'm Darren Spearman for Southeast Agnet.
Whether you're building it up or knocking it down, get it done, rent it now. Sunbelt Rentals is here to make your job a little easier. Our knowledgeable staff will help you find the right equipment for any job, big or small. Did you know that Sunbelt Rentals carries heaters, air conditioners, generators, lighting, traffic control, and so much more? So whether you're building it up or knocking it down, we've got the equipment you need. Get it done, rent it now. And right now, for a limited time, you can have it for less. Just by mentioning this ad, if you rent it Friday afternoon, you can keep it the whole weekend and only pay for one day. But this is a limited time offer, so stop into Sunbelt Rentals today, Northwest 27th, just a quarter mile east of I-75. For more information, just give us a call, 352